Here and Now, the program featuring the news and interests of the African American community. Here's your host, Sandra Bookman.
Coming up, closing the racial health gap. How the Arthur Ashe Institute for Urban Health continues its efforts to save lives in underserved communities. For the first time in 3 years, the Arthur Ashe Institute for Urban Health will be hosting its annual Black Tie and Sneaker Gala in person, the Sportsball 2022 fundraiser. AAIUH was founded 30 years ago by the late Arthur Ashe, the first African American to win the U.S. Open. His aim was to reduce health disparities and improve health outcomes in underserved communities. Here to tell us more is Dr. Marilyn Fraser, Chief Executive Officer of the Arthur Ashe Institute for Urban Health. So nice to see you again.
So nice to be here. So nice to see you all again. Thank you.
30 years. I figure when you're around 30 years, that means that you are really on mission. Talk to us a little bit about what the mission, the Institute's mission is.
So the Institute's mission is to address health inequities and to address that through community engagement and health promotion, and also to increase people of color in the health professions. And we do that through our Health Science Academy program. And
look, the last couple of years, certainly there have been quite a few health challenges for all of us. And I would think that, especially with COVID, that kind of really went to the heart, the inequities that we saw with COVID. We knew they were there, and COVID just put them right out there in the front row.
Exactly.
How were you guys able to, I guess, use that to not only address the issue, but also get people's attention?
Exactly. As you said, we knew those health inequities existed. We knew the disparities existed, but COVID brought to light the importance of the work that we do in terms of going out into the communities, being in places where the messengers are trusted, such as beauty salons and barbershops, just as community events, so that we can talk to people about healthcare, talk to people about how they can improve their health, but also giving them the messages that are needed at that time. So trusted messages and reliable messages, because as we know with COVID, we had things all over the place, right? And we had different messages here and different messages there. And people wanted to know what they needed to do to protect themselves, to protect their families, how to get access to services. We found out that sometimes people didn't have food. So the social determinants of health, housing, food, transportation, all of those things that are there within our communities were just brought more to light with the COVID pandemic.
And, you know, COVID has sucked up a lot of the air in the room over the last few years when we talk about healthcare, but certainly there are other health issues that we really see in particularly communities of color, which are a lot of the underserved communities that we're talking about. Are there some other issues that you guys particularly like to highlight and try to keep on the front burner? Because I think a lot of those impacted our outcomes when it came to COVID.
Of course, you know, we talk about those underlying conditions, and we talk about diabetes and hypertension and things that are sometimes rampant in our communities. And a lot of those things go back to the way that we eat, our diet and exercise, and having access to care, which sometimes we do not have. So making sure that people knew those things, and going back to when we talk about cardiovascular disease and diet and exercise, knowing your numbers, knowing your blood pressure numbers. What do those numbers mean? How can you control your blood pressure? Knowing about diabetes. And because those things really underscored what was taking place in our communities and made us more susceptible to something like COVID. And should another pandemic come, we need to be prepared and make sure that we are taking care of ourselves.
And cultural sensitivity, that is important when you're trying to get the message out, right?
Of course, yeah, making sure that things are tailored to the people that you're dealing with, and making sure that things are culturally tailored. Even with our messages, we make sure that those messages are culturally tailored to our community members, and having the buy-in. So our communities are the ones that know what's best for them, and they are promoting that as well. So even when we talk about diet, and everything doesn't look like the plate that we see for our communities.
And one of the things that you've always done that we think is particularly important, the fact that you really encourage those people from underserved communities, minority communities, to pursue careers in science and medicine so they can make the needed changes, improvements from inside.
Exactly. And, you know, when Arthur Ashe founded the Institute 30 years ago, he was really cognizant about that, right? Making sure that our healthcare system was diverse in the care in terms of the practitioners. So we do that by training our young people, those young people that are interested in math and sciences and healthcare professions, that they come, and we have an after-school science enrichment STEM program that they participate in. And we hope that they will go into the health professions and not just going in knowing the science and so on, but going in understanding the disparities that exist. And over the 30 years, I guess you've seen quite a bit of that. We have seen students that have come back into the communities and have served as healthcare practitioners within the communities from which they come. Which is nice, a nice pat on the back for the work that you've been doing. So let's talk about this big fundraiser. I call it the Sneaker Ball, but it's the Sportsball 2022. First time you guys have been in person in 3 years, considering the pandemic we've gone through. How big a deal is that for you? It's such a big deal. You know, when you talk about having something that's virtual and people say, oh, yes, it's nice and so forth, but there isn't anything like being in person, being able to talk to people, touch people, just see people, the expressions and being in people's space. So this is big for us, and it's coming on our 30th year. It's our 28th Sportsball, but it's in our 30th year that we're celebrating that. So it's a nice time to come back together, kind of like getting family back together and celebrating and sharing and breaking bread around tables, so to speak. So I'm excited about that. And you've got several honorees, I think, that you... Yes, we have Dr. Kita Demisi, who heads the School of Public Health at SUNY downstate. Downstate, we have Mr. Anthony Welters from Sync Care, and then we have Lori Stokes, a journalist. So we're really happy about having them as our honorees this year. And all people that in some way have impacted the work that you do. And the funds that are raised at the gala, those are used for your... Yes, those funds the funds that are raised are used to support the Institute's programs. Oftentimes, as a nonprofit, you may have program dollars that come from specific funding and specific grants, and this is funds that are used to support our unrestricted work, to make sure that we are doing the work that we keep on doing, and making sure that we are reaching more people with the information that we need to get out there. So it is really important. It helps us as a nonprofit really support the work that we are doing. And there are still tickets available for There are still tickets available. There are still tickets available, and you can just go to our website at www.arthurasheinstitute.org. Can I ask you one last question before you go? Has the mission changed much, or how you complete your mission over that 30 years? The mission has not changed much. I think one of the things that has changed is really increasing technology and incorporating technology over the years into our mission, making sure that we're reaching people in different ways. Before COVID, we didn't even think about Zoom as an avenue to reach people and an avenue to provide health education, and we did just that. So it provides an opportunity for us to replicate our work, for us to reach people in different places, and not necessarily being right there in their space, but being in their living rooms and being wherever they are in a different way. So that has changed. So an extra way to get that message across. It's an extra way to get that message across. ArthurAsheInstitute.org. Yes, ArthurAsheInstitute.org. All right. Dr. Fraser, thank you so much for being with us, and thank you for the work that you do, the important work that you do. Thank you so much for having me here today. Our pleasure.
Sandra Bookman, and Here and Now. We'll be right back.